My name is Joe. I'm a PCA here at Rogers Behavioral Health. A typical day for a PCA on the inpatient unit starts off by coming in, getting right into morning huddle, and going over our unit and talking about patients, getting the day started, making sure that we're all collaborating on the same level, talking about what need to be met right away in the morning, and making sure that we're getting out on the floor and checking in with the patients right away. We go around to each patient, check in and see where everybody's at, and we start by doing vitals and get the day started by going over schedule and making sure that we're staying on track with our curriculum and clinical schedule that we have for the patients.
So when you're doing your vitals this morning, get your breakfast.
Throughout the day, there are many things that we can be asked to do as a PCA by patients, by clinical staff, by RNs. We are the eyes and ears. We are on the floor, so we hear and we see what's going on with the patients, and that's a vital tool in communication to pass along at all levels of the clinical team. As a PCA, the computers are used quite a bit on the job. One thing that we use the computer for is charting. We have access to patient charts, which we can see communication orders, which are important. We get to see when people are coming in, we get to see when they're leaving, special orders for dietary reasons, we get to see that and we can be up to speed. We can check things for nurses, we can communicate via email. It's very important. We get to see emails coming in and out, whether it's from your manager or the small treatment teams, from doctors and management. The physical aspects of the job are, we're on our feet all day. We're always moving. That's just part of the job. We're constantly doing rounds. We have to do them every 15 minutes, which is split between the team of PCAs. But it can seem like a lot, and sometimes it is, but you get your exercise in for the day. The biggest challenges as a PCA would be not taking things personally and remembering that you're not a friend. Keeping therapeutic boundaries is a difficult thing to do, because if you care about what you're doing, and this job makes it easy to do that, and care about what you're doing and what you're contributing as a whole, you know, the challenge is going to be keeping your own emotions separate from the job, and that's a big challenge, is just keeping it, you know, therapeutic and maintaining those boundaries with patients and not taking things personally. As a PCA on the inpatient unit, one of the most rewarding things is seeing the lights come on for somebody. And what I mean by that is just something clicking. No matter how small it is, no matter how big of a change it is for them, is watching them transform and kind of come into their own with their treatment. I work at Rogers because I get to be of service. I get to show up in people's lives. I get to contribute to something greater. You know, I know at the end of the day that I've done something good, and I'm doing what I can to impact others' lives and be helpful, and I know I made a difference.